Welcome to Polk Place. I'm Brian Lacey, and joining me in studio is Tina White. She's the Executive Director of Citizen CPR, Inc. in Polk County. Welcome to the show.
Good morning, thank you.
Yeah, we kind of got a history, don't we?
We do.
Kind of fire rescue folks.
Yep,
Yeah.
20-some years.
Yeah. Had the pleasure of seeing you out in the field and being in some of your classes, and yeah.
Hope you enjoyed them.
So now you got a new gig.
I do have a new gig, Left Fire Rescue. I had an association with Citizen CPR as an instructor. Left Fire Rescue took a little more active role, became their lead instructor, monitoring and managing the other instructors and trainers, and now I am currently the executive director, so I run the whole shebang.
So let's talk about Citizen CPR. What exactly is it that they do, and why is it important to this community?
Okay, so we are the only nonprofit in Central Florida that our focus is teaching CPR and first aid in the community. Each year, there's more than 350,000 cardiac arrests that occur in the United States outside of a hospital setting. Most people's bodies don't have the common courtesy to have an incident in the hospital where you've got the doctors and the help that you need. So only about 45–46% of those receive some type of what we call bystander CPR. That's our lay public, our non-trained professionals, before the primary professionals arrive. So our goal is to increase community awareness, education, to try to increase that number. The more instances of pre-hospital CPR that's provided, the higher instances that the patient has a chance of surviving.
Give me that number. It's pretty amazing too. If something, if you've got the CPR and the AED going on, the chances of survival are much greater.
Phenomenally, 2 to 3 times more likely that you are going to recover from that cardiac arrest event. Yes.
So let's talk a little bit about the classes. You guys do stuff, you have classes of which the public can come in, and then you also have other classes that you're willing to do for a little bit larger crowd, say, whether it's homeowner association, something along that lines.
Right.
Let's talk about that.
So we are a training center for 2 different national organizations. The first is American Heart Association, and the classes we teach for them are healthcare provided based. Our doctors, our nurses, our EMTs, our firefighters. And then we work with a company called HSI, formerly known as ASHI, and that is our public place classes for, mom and dad that have children, daycare centers, schools. And that is based on the public level. It's not advanced. It's as simple as recognizing that the person is in cardiac arrest, providing the chest compressions, if they're comfortable, providing the ventilations. And for those that don't have that comfort level, we teach what we also call hands-only CPR. And a lot of our elderly communities, they purchase AEDs, they do things, and we go out and we do a hands-only CPR class and an AED demonstration for them.
So obviously, tools of the trade. We've got adult size, we've got kids side, and then we've got some of the other things, the AED, and of course the mask.
We do.
So talk to me a little bit about the full size.
Okay, so our full size with our adult, and these are our newest mannequins. We've just purchased them about a year ago. Pretty as close as you can get to having a life-size adult without carrying around a 200-pound mannequin. So it's very effective. Gives you a pretty good simulation of what you would feel, could be going on if you're doing chest compressions. When you do your first compression, we have some lights that activate in his chest, and it helps you know, are you doing the correct depth? Are you doing the correct rate to give the heart the best chance of circulating blood through the body? For those that want to do the ventilations in the classes, resuscitation mask with a one-way valve protects the patient from you, protects you from the patient, and they have integrated lungs so that when you give that breath, you can watch for that chest rise, and that's your indication that you've got good breaths going into the patient.
Talk about the importance. I mean, I remember sitting through classes out at the old EMS headquarters, and some of the stuff, man, I mean, technology has just, it's just, wow. The fact that the chest raises with the breath, it's telling you, it knows the pressure that you need to apply. Talk about how technology helps you teach.
It's actually really good because you can visually see that those breaths are going into the chest. The compressions, when you do the mannequins, when you hit the right depth, in addition to the lights, there's a little click. So before, you had just these big mannequins that just laid there, and you were hoping, oh, I think I'm pushing deep enough, I think I'm pushing right, and no lungs in there. So the technology has given the general public the ability to see that, yes, I can do this, and yes, I'm doing it correctly, and it's not as difficult as what people think it is.
Let's talk a little bit about something very important, CPR on a child.
In our infant, and that is probably the scariest incident that anybody's ever going to come into. Everything with kids are so much more dramatic. So we teach the CPR with infants. What we tell people is it's not different, it's just different. 2 fingers or hands and thumbs instead of full chest compression. Same thing with ventilations. We just have to remember they have very small, tiny lungs, so they get very smaller breaths with that. In our CPR classes, we also cover choking, both for the adult, the child, and the infant. And as we know, infant choking tends to be the most common things with them.
I was doing a fundraiser for the American Heart Association. They brought me in an individual who was playing tennis at one of the tennis clubs here in Polk County, and he was playing against a doctor. And went into cardiac arrest, dropped. Doctor knew exactly where the AED was, and had him revived within minutes.
Yes.
And back in the day, these units were not as readily available.
Correct.
Now, they're small, they're compact, they can go anywhere, and wow. And if you can follow directions, you can work them.
Absolutely, absolutely. Like you said, the AEDs previously were so expensive, so huge, so bulky. Pretty much your hospitals, your emergency systems is the only place that had them. We are actually a distributor for both Philips and Zoll AEDs in the community. But you can find them anywhere now in churches, in daycare facilities, in schools, and pretty much every county building, city building, private venues that you go to. And like you said, they're as easy as turning it on. Some of them, you open the case, it turns right on. Others, you push the button. And I tell people, 6-year-olds don't generally follow instructions very well because they're kids. You could hand this to a 6-year-old, say, listen to what it says, walk them right through. They can turn it on. There's pictures on the pads that show you exactly where to put them, so you can't put them in the wrong spot unless you don't follow the instructions, and it guides you perfectly through every step of it. The majority of cardiac arrest, especially in adults, at some point, their heart goes into a arrhythmia that they call VFib, which is the heart quivering and shaking. And the AED uses basic electricity to shock that, to kind of, if you think about rebooting your smartphone or your computer, and it tries to restart that to get that heart back in that nice, steady beating rhythm. It's not always successful, but is one of the best tools for, like you said, very early on to convert that rhythm and try to resuscitate the patient.
We got about 30 seconds left. Okay. Inspire folks to get involved with you. Tell them to get out and see you, come down, or have you guys come teach them, because what you're doing is vital to this community.
We truly believe in it. When I retired from fire rescue, I stayed with Citizen CPR because I believe in it. I see cardiac arrests in the field every day. The ones where families provided CPR did make a significant difference. We offer public classes about 4 times a month, both for the healthcare provider level and for the public level. You can go to citizencpr.org, follow our website, sign up, register for classes. We do classes for private companies, and if you are a group of 6 or more, we will come to your house, to your business, give you the training you need right then and there.
You know what this means, right?
I have to come back in a couple months.
Yep, you gotta come back. It's not so bad, is it?
No, it's not.
All right.
It didn't hurt me.
Listen, man, anytime we can help you promote this incredible cause, the chair is yours. Come back and see me again soon, please.
Thank you.
Citizen CPR is a nonprofit training organization whose mission is to reduce premature death and disability from cardiovascular diseases, sudden cardiac events, and drowning in the greater Polk County area. Citizen CPR offers CPR instruction to fit your needs. They offer basic and professional level certification instruction. Certification and non-certification classes are available for groups of 6 or more. Need to check on a class schedule or sign up? Look them up at citizencpr.org or give them a call, 863-680-1277.